All right, so now we're going to talk about pregnancy and some autoimmune disorders. First, I want to talk about lupus, systemic lupus erythematosus, or SLE. It's a chronic multi-system inflammatory disease that is autoimmune. They don't know what causes it. It tends to happen in exacerbations and remissions. So they have an exacerbation, they may get better. We don't really know if pregnancy worsens or increases the risk. What they do know is if they exacerbate at the beginning of pregnancy, then they tend to keep having exacerbations. The risk, women with lupus are more likely to have a miscarriage. They're more likely to have nephritis, which can be a complication of lupus anyway. Pregnancy makes that more likely. They're more likely to have preeclampsia. They're more likely to need to deliver early. There's an increased chance of a C-section. They can have an exacerbation during labor or postpartum. Each pregnancy tends to increase the stress, and so the vascular and renal disease tend to get worse with each pregnancy. Management, if they're in remission or they're mild and they don't give them a whole lot of meds, but they do need to be monitored for exacerbation. If they have a lot of pain, they can take occasional doses of NSAIDs, but frequent use of NSAIDs can cause the ductus arteriosus. Remember that opening between the pulmonary artery and the aorta? Too many NSAIDs can cause that to close prematurely, which does not allow for fetal circulation. Glucocorticoids, like prednisone and steroids, might be used. There is a slight risk of cleft lip and palate, but that's usually lower than having an exacerbation. They also cause bone demineralization. They can contribute to gestational diabetes, to preeclampsia, premature rupture of membranes, or IUGR. Hydroxychloroquine is sometimes used for this, and it does not appear to have any adverse effect on the fetus. They need more frequent monitoring for gestational complications. Usually they need to be delivered early. Myasthenia gravis is an autoimmune disorder that affects motor function, especially the eyes, face, tongue, neck, limbs, and the respiratory muscles. So the worst outcome of myasthenia gravis is going to be paralyzed respiratory muscles. Pregnancy does not appear to change the course of the disease, but if they already have some respiratory compromise, that gets worse as the uterus gets larger. For the first year after diagnosis, someone with myasthenia should avoid pregnancy. During pregnancy, they should maintain their regular treatment. That's usually going to be glucocorticoids, acetylcholinesterase inhibitors, that's cholinergic drugs. Monitor their blood glucose because of the steroids. If they have a lot of weakness, sometimes plasmapheresis or immune globulin therapy can help. A thymectomy may induce remission, but they try not to do that in pregnancy. Vaginal delivery is preferred. They may do okay in labor, but probably need assistance with delivery because of the weakness. Relapses are really common in postpartum. So in the postpartum period, they need to be monitored. The infant is observed for neonatal myasthenia. It's a transient response to what's going on, the chemicals from the mother, but it may need to be treated with those cholinesterase inhibitors. Okay, we actually have one more section. I'm going to combine HIV and substance abuse because both of them are pretty short.